What's up, everybody? How you guys doing today? This interview is a little bit different than what I usually do. Usually I interview people who have disorders. In this interview, I interviewed someone who has been a clinical psychologist for almost 20 years, who has dealt with people who have cluster B personality disorders, specializing in BPD and NPD. She is an amazing person. We talked a lot before the interview and after. She does a great job of describing NPD and BPD and her experience treating people with these disorders. I just want to say she has a YouTube channel, so I'm going to tag that below. She also has an Instagram. I'm going to tag that as well. She's an amazing person, and you guys are really going to like this one. If you guys like my other ones, you're going to like this one, so enjoy. What's up, everybody? This is Wavy Thoughts and Talks. My name is David, but everyone calls me Wavid. I do a series on my YouTube channel where I interview people with different mental health conditions. The point of these interviews is to de-stigmatize disorders and humanize people afflicted with them. The best way to watch them is from an unbiased, non-judgmental point of view. What I'm trying to do is empathize with someone and put myself in their shoes. But with this, it's a little bit different. I'm not actually interviewing someone who has a mental health condition. I'm dealing with a mental health practitioner, a clinical psychologist. So with that being said, introduce yourself to the people.
Hello, I'm Ruth. I'm a clinical psychologist and I specialize in relationships, cluster B personality disorders, and issues of narcissism.
Okay. What got you? Well, first off, what was your upbringing like? What was your? I'm interviewing you, so what was your upbringing like? Where are you from? What what were your parents like?
Oh wow, we're going deep.
Oh yeah. I'm interviewing you.
So I grew up in Northern Ireland. I grew up in what's called our Troubles, which was a time in which there was a lot of terrorism and sectarianism and violence within our communities. And I grew up amongst very extreme beliefs and clashing extreme belief systems. And, my family were pretty ordinary. They were a normal, loving family within a really complicated political landscape, which I was rather blissfully unaware of. And I knew there was terrorism. Mm-hmm. I knew there was deep divisions within our society, but I thought it was pretty normal. I didn't think it was strange. And I didn't know why when other people would come to visit us, they were scared. I'm like, why are you scared of the soldiers?
It's Northern Ireland, right?
Yeah.
So that part is still attached to the UK, right?
Yeah, it's still part of the UK.
Okay. I remember, I think that was like the 90s or the late 80s, maybe, I think, when they had all those conflicts going on in Ireland.
Yeah, but they were probably at their worst they started the 60s, the 70s, the early 80s were pretty bad, and I grew up in the 80s and 90s.
Gotcha. Yeah, I grew up in the 90s, so I was born in 91. So that's I slightly, my grandpa's from Ireland, so I slightly remember it. Like not a lot, obviously, but anyway. Okay, so what got you into the field that you do? What got you into psychology, and then what pushed you on to, I guess, going down the avenue of dealing with cluster B patients?
I think I was always interested in people, and in people who might be different to me, and I was interested in conflict resolution because I grew up in this conflict with these warring factions, and I had friends on both sides from all communities. I moved house when I was about 8 years old, and I moved from an area which was predominantly it was predominantly Protestant, and my family are from a Protestant background, and we moved to an area that was predominantly Catholic. So I had friends from both sides of the community, that's not unusual, just to say that people did do that. And so I kind of just grew up in this kind of strange environment where there's such strong ideas, and there were very ordinary people just getting on with their lives in the middle of this kind of circumstances. And it made me interested in people, and it made me interested in resolving conflicts between people and, you know, struggles of power. And also then kind of realizing that my perspective on things was rather different from some of my family's perspectives on things, and what that was like for them, and kind of living with the kind of, I don't like what you do. I don't like aspects of what you do. I mean, no one in my family was a terrorist, but some had much more extreme political views than I hold. So, you know, I kind of grew up with that. And then I was interested in people, and I decided I'd study psychology at university, and I loved it. And then I decided I wanted to pursue clinical psychology, so I did. And then in my training, personality disorders were really stigmatized. Back then, so I trained in the mid 2000s. So I was starting to kind of do my sort of getting into kind of my first introduction to clinical work would have been in the early 2000s. And, you know, back then, dialectical behavior therapy was in its infancy. Schema therapy was in its infancy. And there was a really pervasive belief that borderline personality disorder could not be treated.
Yeah.
And the belief from many of my supervisors when I was starting out was, you know, don't give borderline patients to the trainees because they're too difficult. And I got to the end of my training, and I was, you know, towards the end of my training, I was like, I would like to work with someone with borderline personality disorder because I hear about them a lot, and I'm going to have to work with them when I qualify. So I should start now, right? And so my supervisor gave me one, and I was like, can I have another? Oh, what about another? Maybe I'm just getting lucky, but I'm liking this work actually quite a lot. And then I started to kind of meet other people. I had a mentor at university who was just a really lovely mentor. And I said to her, I'm struggling to understand why people have so many problems working with borderline patients, because, and maybe it's just me, like, am I missing something? And she was like, oh, no, you're one of us. And I'm like, what do you mean one of us? And she's like, no, I like those patients too. There's actually quite a lot of people who like those patients, but it's just not the dominant story that gets told about them. Yeah. And so I started to find other therapists who like working with these patients. And at that time, DBT began to explode and schema therapy began to explode. And there's also some studies in like really specialized cognitive behavior therapy for borderline personality disorder at the time. So I just kind of started doing that kind of work. And, you know, I was working in NHS, which is our National Health Service. So it was public services, really seeing anybody within the teams I was working in. And so I worked with the full range of people with personality disorders, sometimes diagnosed, often not actually, often diagnosed with depression or anxiety, but it was clearly a bit more than that. And I just enjoyed it. I just liked this kind of work. And then I went into private practice and was finding that I had this quite strong sprinkling of people who had narcissistic traits. And I was like, this is okay. And I'd worked with plenty of people with narcissistic traits when I was working in the NHS. And then I was finding that because I was able to, you know, I was okay at doing that kind of work and I quite enjoyed it. A lot of the people who were referring to me were like, well, we'd like to refer you some more. I was like, okay. And so then I was like, well, I need to get some more specialist supervision. All therapists, however experienced you are, have supervision with another therapist who's more experienced or experienced in different things to it's kind of mentoring and personal development. So I asked Wendy Berry if she would supervise me. This was during the pandemic, just as the pandemic was starting. And I was like, hang on. If therapy's by Zoom, I can have a supervisor in a different country. I'm not constrained by who's local to me. This had never occurred to me before.
That's interesting. I didn't know that.
Yeah, so it was at the beginning of the pandemic that I was working with people with NPD before that, for many, many years. But then I was like, no, I want to get extra mentoring in this and really begin to think more about it. And I think as well at that time, I was getting a bit irritated with what I was seeing on social media because I was like, hang on, that's not right. That's not true. That's a big oversimplification. So I kind of was like, no, I want to kind of hone my thinking on this. And see where it goes. So that's kind of how I got into it.
That's really it. There's a couple things I want to say. Okay, so that's fascinating to me. For a long time, I knew someone who had BPD that really cared for this person and trying to get them into therapy. I'll never forget how she was willing to go into therapy and people were just closing the doors in her face. And this is actually during COVID too. So it wasn't literally, it was like you said, during Zoom or whatever, but she would, call to make the appointment. It would get to the point where, and it wasn't really allowed, but I would have to talk for her on her end because she was getting so frustrated that she's trying to get help and people were not. Once they heard borderline, they didn't want anything to do. Oh, we have to send you over here or send you over there, or we can't really do anything here. And it's refreshing to hear that there's someone out there that that is that doesn't view it so negatively, or that you were, as your experience went on, you were just kind of like, okay, so I understand this might be something difficult for some people, but like, what is it exactly am I missing here that's making it so hard for anyone to deal with? So that's good to know. That's good to know. It's good to hear, at least.
Yeah. When I remember being very newly qualified and going to do some training with Christine Podesky, who is a very well-known cognitive behavior therapist and trainer. And she was doing a training workshop on personality disorders. And I was like, I've got to go. I want to go. And she said something, I'll never forget it. She started the workshop with asking people for their beliefs about personality disorders. They're untreatable and they're really difficult to work with and it's impossible. And she gave an example of a therapist she supervised who was like, no, they're very difficult to work with, they're impossible. And she pointed out, look, you had this person you were working with, and you said they had narcissistic personality disorder. And they've done so well. What do you make of that? And she said, well, my original diagnosis was wrong.
Okay.
And it was like, and she made the points like, you're dismissing. We tell our patients not to do this, that you have a belief and you start to dismiss evidence to the contrary.
Okay.
And so she made the case, and I agree with her, that one of the biggest obstacles to successfully treating people with personality disorders is the beliefs and attitudes of the therapist. And that you have to deal with that first. And she also said something that I'll never forget, because when she said it, I was like, exactly. And she said that people with borderline personality disorder are the easiest to work with in therapy, because they're suffering so much, they have a high motivation to change.
Yeah.
And that if you give them the right tools, that change is very possible.
Oh, before I forget, I just want to say that you mentioned it earlier, DBT being in its early stages. If anyone watching has BPD or you have, I don't like people diagnosing themselves, but if you've done enough research, you think that maybe the shoe fits a little well or whatever, and DBT, dialectical behavioral therapy, it was I think created for people with BPD, but it's not. It can work well for people who have addiction, substance abuse disorder, or all different types of issues that you have going on in life. But I've witnessed it personally work very, very well for people who have BPD. So I think anyone who's watching, you have a lot of interpersonal turmoil going on, and you don't know where to go, where to turn. Unfortunately, at least in America, I don't know about the UK, but in America, you kind of have to pay out of pocket for most places that offer DBT. So you got to have, for me, I was paying $80 a week in order for my person I knew to be able to do it. So anyone watching, if you have BPD or whatever, I'm sure you've heard of DPT. If you've watched this video, you're watching this video right now, you probably have, done enough research on your own. But if you're watching it, definitely do DBT or look into how to get into DBT. It does work. It's not an overnight thing. It takes a while, but it does work. I witnessed it. So, okay. So for you, I guess the better question would be, what do you think personality disorders stem from? Or like, what do you think they are, and what do you think they stem from?
I think, they usually stem from childhood trauma and really unmet childhood needs. So it's not just a one terrible thing happened to you in childhood. It's usually multiple terrible things on repeat were happening to you throughout your childhood. And that can also be neglect. It can be about what didn't happen as well as what did. But it's a kind of chronic, pervasive kind of trauma or unmet need, like your kind of core needs, what you need not being met. And it's that in combination with your kind of underlying temperament that's going to produce a kind of personality. And I think, what is personality? It's about the way you see yourself, the way you experience yourself, the way you see and experience other people, the way you experience your relationships, your patterns in relationships, those kind of just patterns that happen on repeat in different relationships. That's your kind of personality structure. Yeah. And it's when those things cause you distress or disable you or stop you from being able to function well is what makes it disordered. I think it's also really, I think it's really important because sometimes people see personality disorder as a term is quite insulting, like you're saying, your personhood, your humanity is wrong. And I think it's really important to say that's not what a personality disorder is. A personality disorder is when the ways that you see and experience yourself and your relationships are not serving you.
Okay. Yeah, I agree. You know, obviously I don't have not a million. I don't have a whole, I don't have decades worth of experience interacting with all these different people and stuff like that. But from what I can tell from the outside looking in, and there's personal things I've dealt with, it's just seems to me like it's rooted in trauma. It's kind of like as you're growing and developing into the person you're going to be, like you said, it could be neglect as well, or it could just be, you know, an abusive, traumatic environment, a situation, and it's repeatedly happening to you, whether on a daily, a weekly basis. I mean, it's a little more complicated than that, the way I think of it, but it's like you're a mold, you're a child, you're, you know, a young adult, a teenager, whatever, you have this certain, probably even before young, I would just say as a child, you have this certain mold to you, and you're becoming whoever you're going to become, you know, in life. And let's say you're also picking up traits from your parents, or, you know, or maybe lack thereof. So people just around you, and slowly the mold, you know, it could grow to be like I guess a full functioning human being or whatever that loves themselves, loves others or whatever. Or, you know, it's kind of just what you're shown in life at a young age. And it's not so much, okay, I had this one incident happen to me when I was 5, or another one when I was 6, another one when I was 8, another one. I mean, those huge incidents of traumatic things happening will definitely affect the person, but I kind of believe it's also the daily, hourly thing. It's a lot more complicated. It's a daily, hourly, how you were raised as a child, and or I guess, or not raised, whatever. But yeah, I agree on that. So okay, so right now, I guess you're a clinical psychologist, and what would your specialty be? I guess cluster B personality disorders. So do you deal with people who have BPD, people who have NPD, ASPD, HPD, or is there one that you kind of strictly do a lot more?
I mostly work with borderline and narcissistic. I don't do forensic work, so I don't work with anyone where there's a high risk of violence to others. That's beyond my skill set, I think. So I would usually refer those on to people who are like have more forensic experience than me. Those are, you know, psychologists who work with people who have come in contact with the criminal justice system for some reason. And HPD, I probably have worked with people with HPD, but it's rarely diagnosed.
That's the one where it's so hard to get decent amount of information about, or at least accurate information about. I kind of, when I looked into HPD, and this is just me from the outside looking in, it seemed a lot like just a different version of narcissism. It seemed, or I don't want to say it's exactly narcissism, but it seemed like, you know, how kind of borderline is kind of like the reason why they came up with the name borderline is because it bordered on being neurotic and psychotic. So they said, okay, well, it's on the border of both. and it had all these different traits among cluster B, where it was kind of like, all right, well, it's kind of like this, but it's also kind of like this sometimes. So they kind of just made a mashup, like a mashed potatoes of not mashed potatoes, just like a mashup of different cluster B personality disorders. And I think they kind of just put a label on it, and they said that's borderline. To me, HPD, I from what I could tell, it just seemed like it seemed more related. It seemed more like narcissism, but just presenting itself a little bit differently.
It's a bit different. I mean, I'm not an expert in HPD by any means. And I don't even know who would be an expert in HPD to say, well, this would be a good person to look up.
Yeah.
HPD is much more about I need to be the focus of attention.
Mm-hmm.
And it can be very superficial and shallow.
Mm-hmm.
You know, like the person will have a new crazy hobby every week, or they'll have to tell you a new, very dramatic story about something that's happened to them. But it's kind of shallow, but it's about being the most entertaining, the most seen, the most acknowledged person in the room. Narcissists need to be admired.
Okay.
You know, they're not necessarily in need of being the center of attention all the time. Sometimes they are, but it's more, I want to be admired. I want to be looked up to.
Oh, okay. Yeah, to me, and you know, there's any, because to me, I'm not personally very attention seeking. Like I don't feel uncomfortable when there's attention on me, but I don't outwardly go searching for it. I don't go looking for attention. So anytime I hear anything about admiration, they all just kind of sound like synonyms to me. Wanting attention or wanting admiration or wanting to be, you know, it just sounds so similar to me. You know, I guess there'd be the reasons why somebody wants this or this, and what that would make it the difference between what it is. I mean, plus the actual word admiration is different than just wanting attention. But okay, so what would you think? What do you think narcissism is at its core, or what do you think narcissistic personality disorder is at its core?
So I think really at the core is an inability to tolerate or accept being ordinary. Yeah. Okay. So it's a lot about shame. I'm so deeply ashamed of myself that the only way I can be acceptable is to be extraordinary.
I haven't heard it worded like that before. I like that. I haven't. I've never heard it worded exactly like that. Maybe similar, but whatever. But not a lack of being okay with being ordinary. You know, that maybe I've heard I guess similar sentences and phrases, but I like that a lot. What do you think? Obviously personality disorders? There's for people watching, there's 10 personality disorders that are, at least, you know, there's 10 personality disorders that are diagnosable. There's 3 clusters for it. There's a cluster A, cluster B, and cluster C. Cluster B would consist of NPD, ASPD, BPD, and HPD. They're all different, which is why they're different diagnoses, but they're similar, and the reason why they're in the same cluster is because I think it's the dramatic and erratic cluster. Yeah, it's and so they share similar traits amongst each other. So I guess for me, my question would be, what do you think the similarities would be in all 4? Obviously, you said you haven't dealt too much with HPD, but I guess for 3 of them, because to me, the one similarity I've noticed is the lack of identity. And anytime I talk to anyone who has a cluster B personality disorder, it's always about a lack of sense of self, a lack of identity. Would you agree that you see the same thing in your practice?
Yeah, well, they all have some kind of identity disturbance. It is in the diagnostic criteria.
Yeah, for borderline, I know it definitely is.
Oh, it's probably that's probably the most extreme aspect of borderline is that.
What could you explain that for me? I to this day I have trouble understanding a lack of identity.
It's like, if you think about it, it's like, you know, if someone's borderline, someone's grown up to become borderline, they've usually experienced a huge amount of emotional deprivation and neglect. They haven't really been seen. They haven't really been loved unconditionally for who they are. And often there's a lot of abuse in their history, a lot of sexual abuse in their history. And so they just don't develop a secure sense of this is who I am and this is what I'm about. And there's a kind of molding to what other people want or need. There's a hypervigilance to other people's emotional states. And there just isn't a sense of this is who I am, this is me, and I'm okay with that.
Okay.
Does that make sense?
No, it does. I've personally witnessed. I don't want to say anything negative. I've personally witnessed, I guess, the lack of emotional, just being loved unconditionally for who you are, and I can see why it would manifest its way like that. But it's just something. I mean, I'm not saying I have the most secure identity or the most secure sense of self out there, but there's one thing that it kind of baffled me. What exactly is? Because then it makes me think like, okay, so who am I? And then I kind of sit there and I kind of struggle to think exactly who I am too. I can think about things I like. I can think about where I'm from or the friends I have or who's in my family. But when it's such a deep question to ask when it comes to like who am I? So for me,
It's,
it baffles me a little bit because then I start thinking about it. I'm like, I don't really think I know exactly who I am either. So then I try to come up with a difference between, okay, well, why am I not emotionally unstable? Or why I do not, maybe I don't have the best sense of self. And sometimes like when it comes to NPD, I relate to like, I don't really, there's times I really don't like myself. I can't say I did a whole video on this. Not that I don't hate myself. It's not that I hate myself, but I don't, all the time, I don't specifically like myself or love myself all the time, but not to the point where I need to externally look for validation to make myself feel better, or I'm need to put other people down, or to the point where I have this extreme lack of identity and I'm constantly floating between who I am depending on the people I interact with or in emotional relation or I'm in relationships with. So sometimes what I try to do is I try to find, okay, so what makes it different? If I can relate to something, I can relate to when I did the interview with Jacob. I was going down the nine symptom criteria for narcissists for NPD, and by like the seventh one or whatever, I'm trying to relate, to it. I'm trying to trying to empathize with it. And he was like, you're relating a little bit too much. And every time I see that one part of the interview, it cracks me up. And I'm just like, well, I'm trying to figure out what happened. Why are you this way? And why am I this way? Not saying I'm better than anyone or anything like that, but what made us so different exactly, And I guess it would be the temperament that you said, but and I guess what I went through growing up or what I didn't go through, whatever the case may be.
yeah.
But
Possibly temperament, possibly differences in your environment. Like there's research that would show that if you have some stable, loving relationships, that's very protective. You can get through quite awful traumas and come out intact if you have some stable. The relationships really serve as a buffer.
yeah.
So really varies. There's so much variability. You can't, we're not little. You can't just put people in and
Yeah.
spread them out. It's not so easy to predict.
Yeah, exactly. Yeah, I guess that for that it was my mom. My mom is definitely she's a very empathetic, loving person. Um, I talk about her almost every video I do. Somewhere along the line, I mention my mom. But yeah, she definitely is like that. Okay, so you said mainly you deal with BPD and NPD. You've talked about a little bit about both now. What similarities do you see between the two, and what differences do you see between the two? Because lots of times when um I hear lots of people with BPD, they don't like being compared or they don't like being in the same boat as someone who has NPD because of the huge amount of stigma. Um, So I'm not trying to say that they're the same thing or whatever, but there definitely are similarities. Like I will say, when I go down vulnerable narcissism, from my own experience with BPD, there is no difference. From my own just looking at
There's
it.
certainly crossover, and there's certainly a high level of comorbidity. And I think some of the main differences I see would be that within NPD, there's not necessarily the same degree of emotional dysregulation that you get in BPD.
Okay.
Yeah.
Yeah.
There is dysregulation in NPD too, but not quite to the same extent. And it also tends to come out more as, well, certainly on the surface, what you see in NPD is probably more anger.
Okay.
Whereas in borderline, you get anger and rage, but it's often comes with much more anxiety and obvious distress.
Mm-hmm.
I think narcissistic people will tend to be more avoidant, emotionally like in their attachment styles.
Okay.
They're more going to push away a relationship, whereas I think borderlines are much more obviously craving of a relationship.
Okay.
Does that make sense?
No, it definitely does. Yeah.
You know, and certainly working in therapy with people, the distinction to me when I'm working individually, I don't really think that much about the diagnosis. You know, I'm much more about who is this person? What have their experiences been? What is the way they see themselves and the world around them? How do they interact in their relationships? How are they interacting with me? What do they provoke in me? Those are the things that are much more interesting. I don't make diagnoses.
I like that.
Standard. And if people ask me and they say, do you think I have BPD or NPD or traits? I mean, I'll certainly answer. But to me, it's not the most important thing when I'm working with someone.
Okay, I like that. I like people. I was actually just saying this with one of my coworkers the other day, how sometimes I get messages from people now that I do this YouTube thing, and I get messages from, I usually tag my Instagram. I get random messages from people, and I tell people all the time, I'm not nowhere near qualified to tell you if you have something or if you have this or that or whatever. And I also, but one thing I try to tell people is you can't. I think one thing I've heard is, and I think I agree with it, is that lots of times people will, or psychologists will hesitate to put a diagnosis on someone, especially when it's in the cluster B area, because or just any personality disorder really, because people have a tendency to, they get some type of acronym on them, they look it up and they make it a part of themselves, and then it's hard to like separate themselves from the actual diagnosis. And I was telling my coworker this the other day. I was saying like how people, they have such an attachment, and I get it. You know, you look up the symptom criteria of something, or you look up okay, somebody tells you, okay, you have ADHD or you have OCD or you have whatever, and then you look it up on yourself. You're like, oh wow, yeah, this really does describe me. This really does fit me. But I like some, like, and I've been guilty of this. I have ADHD, so I'm guilty of attaching it to myself a little bit too much. I actually, for the most of my life, I did the opposite, where I was diagnosed at 6 years old, and then I was never re-diagnosed, but I can see it in myself. I definitely still have it. Even now, it's hard for me to keep a straight linear thought. But I like the fact that you, instead of looking at it, okay, well, you know, what exactly does this person have? You're like, all right, scratch all that. Let me figure out what's going on with this exact specific person. You know, what triggers does this person have? What kind of upbringing do they have? I like that a lot. I think it's way more important to focus on that than so much. I mean, when I do the videos, lots of times I'll go down the DSM. The DSM-5, I think, is only in America, right? Or do people in the UK use it?
We use it in the UK too. I mean, we also have the ICD.
ICD, yeah.
But, oh, who cares?
I go down it because I want people to get an accurate view of whatever diagnosis that I'm doing in the video. So I try to get the symptom criteria for the diagnosis to make it go down. But lots of times I forget to say this, you know, that don't. Well, I do say in the videos, just because I did this Doesn't mean, okay, you're relating a little bit too hard. Don't say you have this. You have to
Mhm.
go to somebody. You have to go
Mhm.
talk to somebody. But I like
Well,
that.
also I think with personality disorders, there's so much comorbidity with other things too.
Hmm.
Substance abuse disorders,
Hmm.
depression, anxiety disorders, PTSD. And what I would also say is that those are the things to treat first.
Okay.
Because sometimes you want to see, okay, I don't know, this person's very self-absorbed and neglectful of their partner, and they're profoundly depressed. Well, are they self-absorbed and neglectful of their partner because they're profoundly depressed? If we treat the depression, what would happen?
Hmm.
So, I think you have to treat the other things first,
Okay.
before you start really thinking about personality disorders.
Okay. I like
And
that.
this, clearly, and also personality disorders are pervasive. You get a history is another a kind of important part of that. But if someone presents to mental health services for the first time, the important thing would be what are the key presenting problems right now,
Hmm.
and how do we treat those?
Okay. Also, that would bring me to, I guess, my
Mm.
next point. Do you think that the huge narrative going around is that people with NPD, it's untreatable. It's I don't want to say I guess you could use the word curable, but that's different. Um, do you think that people who have BPD or NPD, do you think it's treatable? And what type of therapies would you use specifically to treat them?
Okay, so we know BPD is treatable.
Hmm.
Okay, so we have multiple, and this has changed in the course of my career,
Yeah.
right? We now have multiple therapies that we know have some effectiveness in treating borderline. So dialectical behavior therapy, schema therapy, transference-focused psychotherapy, mentalization-based therapy. And I think all of those have merits for NPD too. Yeah, they're kind of sibling disorders in some ways. There's a lot of
Yeah.
comorbidity between the two of them. And I think then you have to ask, what do you mean by treatable, and what are you treating? So, when someone comes and they say, well, they've got some narcissistic traits, for example, it doesn't necessarily mean they have narcissistic personality disorder. And sometimes, what they want is to treat the depression that they have, or the anxiety disorder that they have, or the substance abuse disorder. And in that case, that's where you should treat, right?
Okay.
With medication, with therapies that are specifically targeting those things. And then you see what they want to do.
Hmm.
Other times, people want help only to get through a crisis period. Yeah, so you might help someone through a bereavement or a breakup or a serious illness and something like that. That might be all your therapy is. And then, sometimes as well, I think DBT, for example, is really good with emotional dysregulation. If someone and interpersonal skills. So if someone's relationships are a shit show, and they're kind of like constantly falling out with people, or they're really kind of struggling with DBT was originally developed for people who self-harm or were suicidal.
Hmm.
So if there's lots of self-harming or suicidal behaviors, and substance abuse often serves the same function as self-harm.
Yeah.
For a lot of people with borderline, it's like, I'm going to numb my feelings, or I'm going to give myself some very strong sensations because I want to escape the other things I'm feeling. So DBT is really good with that stuff. I don't know that what DBT's good, DBT itself doesn't necessarily address maybe some of the ways people see themselves, or the ways that, like, if they have a real fear of abandonment, it doesn't necessarily try to address that underlying personality.
Okay.
So it's more skills based. Now, you might, by changing your skills and by being better able to regulate your emotions, you end up having better relationships, and the way that you see yourself and the way you see other people changes as a result of that. Then we have other therapies, so the more psychodynamic therapies and schema therapy, which focus much more on the way people see themselves, the way they experience their relationships, the way they make sense of their early traumas. And, the main therapy I use with personality disorders is schema therapy. So we're really focused on, well, what were the unmet needs for this person? And how do we start to meet them now? And how do I do that in the therapy relationship? So if I have someone and they've never, they've never had someone give them much praise or recognition, maybe part of the therapy would be me giving them some praise and recognition at times. If they haven't had a lot of boundaries and they haven't had anyone stand up to them and say, hey, this really is not going to help you to behave like this. If they need someone to help them hold healthy boundaries, maybe that's part of the therapy. So there's a lot of that in schema therapy. And we also have other strategies too, like we kind of do lots of imagery work. We get people to imagine going back into their childhood and what it would be like if their needs had been met, and changing the way they relate to themselves. So people with NPD will often talk about they really have a hatred for their inner child. Mm-hmm. And it's quite jarring as a therapist sometimes when you first start doing this work, and they're like, you're like, oh, picture your inner child, and they're like, fuck him. I hate him.
Oh my, yeah.
And I'm like, oh,
That's a wild, that is a wild concept to me as well.
Yeah.
I've seen it in every single person that I've talked to that has NPD, or that I've watched on YouTube or whatever. There's always this moment where they have somehow in one way, shape, or form gotten rid of their past self, or I've heard the word like killed their past self, or gotten rid of them, or something along the lines of, and like they'll even refer to that person as a different person. Like, they'll refer to the child version of them as a different person. Mm. That's such a trip for me. I can't even. It's another thing I try so hard to grasp my head around. I can't remember ever going through anything like that. But I guess there are times where I feel like not that I woke up, but like there's times where like it was just I just viewed myself drastically. But it wasn't so much of I killed my past self or got rid of them, or
Yeah, well, of course they haven't actually killed their past self or got rid of them. I mean, that's just not possible. Now I've said it. They're not going to listen to me anymore. But what they've done is develop coping modes, really strong coping modes of cutting off from those difficult, painful feelings, overcompensating. I don't want to feel humiliated, so I'm going to be the most special, most successful person in the room.
Imagine the amount of stress you're under as a child, or as a very young adult, to the point where you can actually, in the moment, cognitively be able to say, no, not anymore, boom, and then stay like that, or in a way be able to keep that up. I feel like me, I would try. I do. Sometimes I don't like the way I am with certain things at certain times. I'm like, all right, David, come on, you're gonna change this. Let's go. And then the next day, 2 days later, I'm back at it doing the same thing. So it's just like there's some type of I don't know what the word is. Some type of dedication. That's not the right word. Some type of, there has to be so much stress you're going under at a specific time in order to be able to do that and then stay like that. Obviously, you said they're not actually getting rid of their past self. They're not actually.
No, and it's
there's also some type of switch that happens. That's what I hear. There's some type of light switch they hit, and it's
tragic, because in a way, I think NPD, more so than borderline, it works better. And by that I mean it can be very functional in the sense of it can bring you a lot of success in certain situations. If you have the right sort of set of circumstances, you can become very successful maybe in one area of your life. And that's not true for everyone with NPD. I don't want to kind of glamorize it, but there are certainly people who have NPD or very narcissistic traits who are at the top of their game professionally, and they get a lot of admiration and they get a lot of recognition and they get a lot of specialness, but it's an intensely lonely place to be. Because the only way to stay there is to be better than everyone else. It's very hierarchical.
Yeah.
So it's not like I have my success and I can be happy for my friend who's successful, or I can,
Yeah.
or I can feel for my friend who's struggling with something without thinking, well, at least I'm not struggling, but I can look down on you with pity. There's no compassion.
Hmm.
So it's like I don't deeply care about myself. And that's why I'm happy for myself when something goes well. It's like I loathe myself. And the only way I can be acceptable is to be spectacular
Okay.
and more spectacular than everyone else, which of course just means everyone else is going to be put down.
Yeah.
And you get a huge amount of envy. And you can't relate to someone when you envy them. You can't be in a relationship of equals if there's a huge amount of envy between you.
Yeah, because you're not seeing yourself, and you're not seeing the entire picture clearly.
Mm,
When you have too much envy or too much jealousy, you're not seeing the entire picture clearly. I try to tell people all the time, you don't really know what someone is going through. So something might appear from the outside looking in like they're doing really great, or it's a great life, or it's whatever. And then meanwhile, on the inside, or just when the doors are closed, they have a horrible family life, or they just have a horrible mental existence, or a mental health condition that probably goes unnoticed by everyone else. They're really good at covering it up, but deep down, they're going through a lot. So
mm,
when you're jealous of someone, you have to, why are you jealous of them? Okay, it's a this specific reason, but you're not
mm,
getting a clear view, 360 view of that person and what they're
mm.
going through in life. So
Yeah. Well, look, and there's a degree to which some envy and jealousy is normal. We all have those feelings from time to time. It's when they're really at their extreme and they're really kind of ruling the show
yeah,
that they can cause a lot of problems for people
yeah,
and can cause a lot of problems in relationships.
yeah, we all experience jealousy. It's just that what type of pervasive level is it at,
Mm,
you know? And then yeah, I guess when you experience jealousy as well, you have to it's a good look at yourself. If you can do it a certain way, if you because then I say, what am I jealous of them for? Why am I jealous of that? If you just keep asking the questions, I ask myself certain
mm,
questions all the time, and like my friends say, sometimes I go a little too far. Because all right, so why am I doing this? So I did that because I do a lot of self-reflection, I guess that's the word. I
mm,
do a lot of self-reflection. So but it can't. I guess being jealous, because one time I brought this example up once when I was talking with Jacob. Got really jealous of a friend who started a business. It was going really well. It's a great idea. And then when I first heard about it, I haven't spoken to him in a while. And when I first heard about it, my first inclination was jealousy. And then immediately I was like, whoa, 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 why are you jealous of him? What's the point? What? And then I had to backtrack it in my head. And I realized, I'm like, bro, first of all, he's doing good in life. Be happy for him. And then like that's kind of where I just left it off at.
mm,
But yeah. So I mean, that's what I say, when I looked up NPD, I was able to relate to a lot of things. But I guess the question in my head, right? So what makes it different? I'm not sitting here
Right.
saying I have NPD, but I
I
guess
guess,
it's a little dangerous. It's a little
in
dangerous.
extreme NPD, they'd experience that envy, and then they'd either, and like you might experience that envy, right?
Uh,
And maybe you're like, well, what I would suggest to someone is what's underneath the envy, right? Is it a sense of, I lack some things, I have some sadness in my life, If you're envy of someone who's in a happy relationship, that may well reflect that you have a loneliness or unmet needs in your relationships. And that's really what needs to be attended to, right? And then you can also be like, well, hang on, like I can be happy for my friend. I'm pleased for them. I can both be pleased for them and feel some sadness at what I don't have and a little bit of envy.
mhm.
You can have all of those nuances. But
Yeah.
what you then don't need to do is avoid that friend or devalue what they do, start putting it down,
Hmm.
or start competing with them.
Hmm. I
Um,
would say use it to motivate yourself in a good way. Oh,
yeah, and
he's
it
doing so
can,
good. I could do good too, but not in the competition way. More as motivation and a positive.
yeah, yeah, yeah.
You know.
You
Okay.
know, and when you're able to do that, it's much better for your relationships because then it's much easier for people to be happy for you
Hmm.
when you are successful.
Yeah.
And it's like, you know, when you're successful and you're able to bring other people with you, I mean, that's a lovely experience.
Yeah.
Right?
That definitely has to be a good feeling. I'm not the most successful person in the world, so I can't. But I would always love. I was talking to my brothers this, like, if I ever just somehow came across $1 million, about a good 200,000 would be divvied up between a lot of important people in my life.
Hmm.
And then
Yeah.
well, the government will probably take a whole bunch of taxes out. So let's say they took the taxes out, and then I was left with 1 million. Then a good portion would be divvied up, and then lots of it would be put it to the side for my kids in the future whenever they may come. But all right. So what's if you're allowed to speak on this? I don't want to uh put your not your career in jeopardy or anything like that. But what would be, I guess, your most difficult? So I know you don't want to talk negatively about certain things. So what's your most difficult thing with going through with dealing with the patients that you treat? What's the most difficult thing you come across? Or yeah.
There isn't one thing. I mean, I think what's really difficult is when some of those narcissistic defenses come up very, very quickly, and it's really difficult to get behind them. You don't know the person. You know,
Okay.
I think and I think you have to recognize it's difficult for someone with NPD to start therapy. You know, because they're inherently mistrustful. They don't view other people as allies or friends. They view them as competition, or as threats.
Hmm.
Someone who could humiliate me or abuse me or take advantage of me. So that's difficult in the therapy relationship,
Hmm.
right? And sometimes the behaviors can be quite extreme. And that can be difficult. And so that's when I really have to kind of, step back and really pay attention to what's going on in me and try to stay as strong and adult as I can and not go into trying to please or tiptoeing around them
Hmm.
or getting really angry and defensive and being like, well, screw you, get
Yeah.
out. I've got a waiting list. I don't have to treat you.
Hmm.
It's like you really have to kind of find that in yourself. That's those early defenses in early therapy, I find much harder than later therapy. I don't know if that makes sense.
Yeah. Yeah. Yeah.
And I think in later therapy, what's different is you have enough of a relationship. They have more trust in you.
Hmm.
So you're much, you're not seen as in quite such a threatening way. And also, you know them.
Hmm.
So you're much more able to, when something happens, you're much more able to recognize early when they've been triggered or there's something going on. And you're also much more quickly able to make sense of it.
Okay. Okay, so I don't want to. I know it's getting late where you are, so
Oh, that's okay. Don't
we're like
worry.
five hours ahead of different or whatever. Like right now, it's only like 5 o'clock here, so it must be like 10 something there. But
Yeah.
I just have a couple more questions. So for anyone who is, because obviously, how do I word this? Okay, so NPD, probably you don't have this out of anyone who has a lot of stuff going on and they want to seek therapy because they recognize they have stuff going on. I feel like with other conditions, not even personality disorders, other conditions, there's a higher percentage of people coming in looking to get treated than compared to people who have NPD. They probably not so many people who have NPD are getting treated and diagnosed. What I'm trying to say is there's probably a lot more people that are out there that have it that are undiagnosed than the people that are actually come in looking for help. I mean, I'm not sure. I can't really base that on any type of statistic or percentage, but that's kind of the way I view it. So when I ask this question, I don't want people thinking, okay, because one of my things I do is try to destigmatize disorders, and this is definitely the hardest one to do. So when I ask this, I don't want people that are watching to think, okay, just because I don't like my ex-boyfriend or my ex-girlfriend, they are a narcissist or they are this or that. But if you think okay, if someone realizes that they're being abused in a certain situation, I guess your advice would be to, at least my advice would be to escape that. But
I
how?
think,
Yeah,
yeah.
yeah.
And I think
Stay.
this is really important. Actually, I'm
Yeah, yeah.
glad you asked because, sometimes people watch my videos. And because I have compassion for people with NPD, and I'll talk about ways in which we can treat it and ways in which you can help it, ways in which you can relate better to a partner who has NPD, people think I'm saying, although I have explicitly said otherwise, therefore you should stay in your relationship where you're being abused. And I'm like, absolutely not. Being abusive is not in the diagnostic criteria for NPD. Now, someone who has NPD, because they are lacking in empathy, because they have a sense of entitlement, because they have a real inability to accept vulnerability and to show themselves, and then when people get close to them, get to know them, they can be very defensive and angry, and that can produce some really difficult behaviors and really hurtful behaviors. So I think people with NPD probably are more likely to be abusive or deeply hurtful in their relationships than others. But it's not inherent. It doesn't have to be that way, right?
Mm-hmm.
And I think, if someone is abusing you, psychiatric diagnosis is not the important thing. The important thing is you're being hurt and abused in this relationship. That's going to have a profound effect on you. So you need to think seriously about what you're going to do and how you're going to manage it. And I say think seriously, not just get out, because, and as much as I want to say just get out, some of these relationships are really dangerous. Mm-hmm. And I think particularly in the kind of NPD sphere, there is this confusion between a type of abuse that is a crime in the UK and is increasingly being recognized as a crime of what's called coercive control. And coercive control is when someone deliberately begins to control and manipulate their partner. And it's calculated. So they do things like and actually now the Crown Prosecution Service in the UK have put love bombing within the definition of coercive control. But they'll talk about the use of gifts as a means of controlling the person, or as a means of looking good to others to avoid their abuse being seen or to avoid being prosecuted for abusive behavior. And what some people in these relationships will do is they will be spying on their partner. They'll be using surveillance technology on their phones, trackers on their cars. They may be denying them any access to finances. So there's like enormous amounts of financial abuse that goes on. They may be stopping them from seeing friends or family, or accessing medical care, or having therapy with a therapist they don't approve of. And they can also convince their partners that they're mentally ill.
Mm.
And it's a deliberate thing. It's like, I'm going to deliberately convince you that you are crazy, that you're mentally ill. Often accusing them of being borderline is a very popular allegation. Mm. And they then begin to make the partner question, doubt themselves. If the partner has a mental illness or they have a neurodivergence, they're like, well, what do you know? You're autistic. You don't know anything. So, you're just interpreting this in a skewed way because the way you think is crazy. And so people,
here, I'm not sure in the UK, gaslighting. That's what.
Yeah. So that is like gas. It is gaslighting, right? And it's gaslighting in the proper. The original movie was exactly that. The guy was convincing her that she was crazy, and his motivation was to steal, which is also common. I've come across this as well, because I work with quite a few victims of this kind of abuse, and it's horrendous. Now, a lot of those victims will come to me saying my ex was a narcissist. And they may well be right, but that is not all their ex was. And I kind of think it's not that helpful to pathologize abuse. This is not a mental health issue. This is a criminal issue.
Oh, okay. I like where you're going with this. I like where you're going with this.
Yeah. So, and I think this is where I think we kind of have to kind of understand that not everyone with NPD is engaging in this kind of extreme, egregious, abusive behavior. And when I say NPD may be treatable, I am not saying that anyone should have any hope for someone who's behaving in that kind of coercive way. And I'll spell this out clearly. If you're in that kind of relationship, you need to get advice from domestic abuse services because there's a risk of homicide. These are the relationships where when the victim tries to leave, violence begins to escalate. And it is cold, calculated homicide that can result. And that's not the norm. That's a relatively rare outcome. But when someone describes that pattern of abuse to me, that's what I'm worried about.
Yeah.
And then people say I trivialize abuse. I'm like, no,
Yeah.
I don't. But then what I also know is you have people who have NPD who are very defensive. They're blame shifting. But the goal isn't to control or manipulate the partner. The goal is to protect their self-esteem.
Mm-hmm.
And they can be deeply hurtful and unpleasant. But I don't think it's the same as the person who's trying to control.
Okay.
And manipulate.
No, I see.
There can be a crossover.
I see what you're
these can be. Do you see what I mean?
Yeah, it's okay. So I mean, you explained it probably way better than I can, but what you're basically saying is there's abusers. There's all right. Let's say in the circle over here, there's abusers. What is it called? The
like a Venn diagram.
Venn diagram. Venn diagram. It's been a while since I've been in school. So so there's abusers. There's people with NPD or just cluster B personality disorders in general, and then there's like right in the middle, something like that.
Yeah, there will be some people with
not
NPD
every
who abuse.
person who has a cluster B personality disorder is an abuser, and not every single abuser is someone with a cluster B personality disorder. Mm-hmm. But yes, if you were to look at it that way, there is something in the middle there, no matter how big it is or small it is, whatever percentage it is, there is a relation there. And for you, and I only do interviews, so but and I try to be very publicly very politically correct when I do these. I try to make sure nobody watching, whether they're someone who's dealt with someone who has NPD or ASPD or BPD, or someone who has one of those disorders, that I try not to make anyone feel offended. So for you, it's hard because not only I'm just I guess a YouTuber now, but you're someone who this is your job. This is what you actually do. Mm-hmm. And the fact that and by the way, she has a YouTube channel. I'll have it tagged below. But when you talk about when you talk about NPD and stuff like that, you're treading a very thin line because you're talking. Your job is to deal with the most stigmatized disorder out there, basically. Mm-hmm. And so you don't want to offend the people who might watch your stuff or who might in the future deal with you as an actual clinician. But you also don't want people thinking out there that you're defending those behaviors that might come along with them as well, certain behaviors.
No. So. And also, I think this is also where you have to be clear about what the nature of the behavior is and kind of what's driving it too. Because anyone with a cluster B personality disorders, their behaviors are in some way interpersonally a problem. Okay, that's just, it goes with the territory. Otherwise, it's not a disorder. So it's affecting your relationships. But with NPD, with BPD, at their sort of core, where you don't add on psychopathy, you're not adding on kind of criminal levels of cruelty, sadism, for example. It's not intentional. The narcissistic person is trying to preserve their self-esteem rather than trying to manipulate and hurt the other person. Mm-hmm. Yeah. Now, the effect may be to really hurt the other person or even to manipulate the other person because they end up tiptoeing around trying to placate them and please them. But that's not the goal, right? Now, if someone approaches me for therapy and even couples therapy, and the partner's acknowledging that they're defensive, that they blame shift, that they become condescending, I'm happy to work with that. Right? They need to work on changing those things, but I'm happy to work with that. If someone comes to me and says, my partner is spying on me, I will not take them on. I will say this is a completely counterindication for couples therapy. Mm-hmm. Right? No way would I take that on. I wouldn't even see them individually. Right? Okay. because the level of behavior is too extreme. It really needs support from services who are equipped to manage dangerous behaviors and criminal behaviors. And so they're different. I think we have to be clear about what that difference is, because I think one of the things that if we start to think everyone with NPD is in the category of evil, abusive, criminally abusive, right?
Yeah.
Why on earth would anyone with NPD seek help? Or even acknowledge to themselves, I'm defensive, or I'm condescending, or I'm entitled. You know? Does that make sense? I'm not even sure.
No, it definitely makes sense. It definitely makes sense.
You know, and I think this is the other thing I often say is, if someone says, is NPD treatable? I kind of say, depends who's asking, right? Because if you come to me and you say, my partner's really controlling and manipulative and they're arrogant and they're entitled and I think they have NPD, can you treat them? Well, my answer is I'm not that hopeful, right? Because they're not asking.
Mm-hmm.
Okay? And I can't treat someone who's not here.
Yeah.
And if someone comes to me and says, I cause problems in my relationships and I recognize that I can be entitled and I can be condescending and I can drive my partners crazy and they get annoyed with me, then yes, I probably can help you.
Okay.
Does that make sense? And it kind of sounds like, almost, you know, it sounds like I'm lying, but I'm not. I'm like, who's asking? Because if you're saying, can my partner change? Well, they're not the one asking the questions. So
yeah, you have to be willing to, this goes with anything, you know, but you have to be willing to admit it in yourself that you need help of some kind, you know, and you need to go searching for it. You know, like I was saying earlier, by someone I was with who has BPD, she was looking for help, trying to get help, couldn't get it. And it was very frustrating. And so then it got to the point where she was getting so overly frustrated and overwhelmed with the situation that I had to actually pick up the phone and be like, hey, so my girlfriend has this. She's right next to me. I'm not making her do this. I'm not forcing her to do this. She wants to do it, but she keeps getting the door slammed in her face, metaphorically. And yeah, you know, she would like to get some help. And so it's funny, I was put in a situation where I was asking, but for her on her side. But yeah, that was it's a wild time. But
it's very hard. I'll tell you what I'll recommend to someone in that situation is ask for a recommendation.
Ask
so if someone says I don't treat borderline, you say, do you have anyone in your network who does?
Mm-hmm.
Because everyone knows someone who does, right?
Yeah.
Because I think you can go round and round trying to find someone. And the other thing, you know, I'm finding this as well. I'm looking, you know, people are coming to me having seen other therapists. And I'll say, well, tell me who the therapist was, and I'll look them up. And I'll often see that, you know, I don't want to be critical of colleagues, but sometimes I'll see this therapist has listed, I work with young people, older people, adults of working age with depression and anxiety, every personality disorder under the sun, psychosis, bipolar disorder, schizophrenia. I'm like, and I do CBT, DBT, psychodynamic therapy, family therapy. And I'm like,
where do you have time for all this?
Nobody can do all that, right?
Yeah.
Nobody. Okay. So you really want someone who has a specialism.
Yeah, that's kind of stretching yourself extremely. Even all those you mentioned, that's a lot. And I'm familiar with more than half of those. And I can't imagine, just think about the amount of hours there are in a week. Okay, so you work 40 hours. Let's say you deal with 40 patients or something along the lines of that, 30, 40 patients, whatever it might be.
That's too many.
That's too many. All right, so 20. That's questions I didn't even get to ask.
Some therapists will be seeing that many. And this is the other thing. You will have therapists who are maybe seeing 30, 40 patients a week. And you cannot know 30, 40 patients a week well. You just can't.
Mm-hmm.
You know, and I remember having a group supervision early on in my career, and it was me and a couple of other therapists. And the other therapists were working in a primary care psychology service, and they were having to see 6 or 7 patients a day. I was seeing 3 or 4 patients a day. because I was working in a team that worked with complex patients. And we would go into supervision and I would know everything about the people I worked with. I knew their partners' names, their kids' names, their dog's name. I kind of had this whole picture of their life. And the others were like, one of the others, I remember saying, I feel inadequate when I talk about my patients because I just don't know the things that you know. And I'm like, yeah, but you know the difference, right? And he's like, no. And I'm like, I see 3 or 4 a day. You see 6, 7, 8 a day. I see people for 2 years. You see them for 6 sessions. There's the difference. Yeah, so I think it's really important. I think sometimes as well, therapists are accused of being too expensive. But if you are going to be a good therapist for personality disorders, you cannot be packing in 6 or 7 patients a day every day.
Okay.
You just can't, right?
Yeah.
Not to do it well. So it's our industry is really messed up, to be honest. It's a really difficult industry to navigate. People struggle to get the help they need. It's a mess. And so I caution people about just going on something like some of the directories, like Psychology Today, Counseling Directory, and just putting in personality disorder and your area, because what you'll get is the therapists who've ticked every box under the sun. So really check their profiles and see, does it look like they really work with people in a long-term way with complex relationship issues?
Okay.
Because otherwise you're seeing someone who's just way too general and quite possibly doesn't know their limitations.
Okay, I like that.
And it's one of the reasons I often ask if someone says, I'm already seeing a therapist, I'll look up their profile. Because just looking at their profile can often give me a little bit of a sense of maybe this other therapist really is out of their depth. And other times I'll say, hang on, no, your therapist is very experienced in working with personality disorders. So now it may be that they're just not a good fit for you, in which case you come back to me. But I think you should talk to them about this first. I mean, I'll always say that to someone who's seeing another therapist. I think if you want to change therapist, you should talk to your current therapist and work through an ending with them before starting with someone else. But I got be wary of the people who treat everything with everything.
And people also think that therapists or mental health practitioners, psychiatrists, psychologists, that they're just like a magic. They can just wave a magic wand after a few sessions and then you'll be fine, or you'll be okay. Or, I mean, like, these are people too, and they don't know everything. They know a lot, and then especially the experience. I think the schooling, obviously, the schooling that someone goes through, because you're learning, then you get a huge basis of knowledge of what you're getting into. But I think lots of it comes when you spend years doing it. Because then you get a good view of so many different people over time, and you see connections, differences, and I think that's when it's not a magic wand. There is no magic wand for trying to fix anybody, but I think that's where the knowledge comes in. I mean, I haven't gone to school for 4, 6, 7, 8 years for anything, so I can't say. But I can imagine it, that just dealing with the different people every single day for months, years, is what.
For sure.
Yeah.
You know what? It's getting to know yourself, right? Because people with personality disorders, they will trigger their therapists, right? They have difficulties in relationships. They will have difficulties in the therapy relationship. Now, working through those difficulties can be the therapy, right? But you have to get to know yourself. You have to get really interested. It's like, why is it that we all have our different reactions. I'm not so, like, personally, I am just not so triggered by strong expressions of anger as some of my colleagues are, right? So I don't get so fearful quickly. Now, I can get fearful, of course I can, I'm human, but I'm okay with these extreme emotional expressions. So I don't get so triggered easily by that, but I can be more triggered by someone who's very condescending.
Yeah, that
And
would
then
get
you're
to
like,
me
well,
too.
why on
That
earth
would
do you
get to me.
specialize in NPD then?
Yeah, that would get to me too.
So, but then you have to kind of be like interested in why am I so triggered by that? What's going on for me? How do I make sense of my own reaction? And how do I make sure that I don't go into my own not so healthy coping modes?
Mm.
Like trying to please them.
Hmm.
Because if you start going, oh, well, I'll try to, I'm sorry that you don't like my office. I'll try to change my office for you. Or what can I do to make you more comfortable? Like, it's not about the comfort level in the office. There's something else going on here, right? So
Yeah.
stop trying to please and get interested in what's really going on.
Yeah. Like, it's like, okay, well, I mean, I like my office, so you came here. Like, I like my office. I'm fine with my office. I mean, why don't you like it? It's not just because the room's painted green, or well, no, that might be a little weird. I mean, it's not just because it's painted whatever color. There's something else going on here.
Yeah.
Something
Yeah.
else
It's
going
like,
on
get
with you
interested.
personally. Yeah.
Get interested.
Mm.
Yeah.
All right. I don't want to make this video too long because then I want people to be able to watch it. I don't want it to be crazy long, and then I feel like people they get disheartened when they see a video that's too long. But I definitely would like to do this again though. This was fun. This was fun.
Yeah. I'd be happy to do it again.
I like talking to someone who knows what they're talking about, first of all, who has experience in this. And I'm going to rewatch this as I'm doing the timestamps. I'm gonna enjoy rewatching it because lots of different points you brought up I haven't exactly thought of previously. So it's going to give me something to think about later. But,
Well, if your audience have questions, tell them to leave comments in the question box. And
yeah,
if there's enough questions and we think it'd be useful, we could do another interview at some point in the
yeah,
future.
definitely, definitely.
Or do a live.
Oh yeah, wow. Yeah, we could definitely do it live. I'm probably horrible. I'll probably be horrible. I mean, technically this isn't live, but Oh, even when you do a live, people can leave comments on it and
Yeah,
stuff and
yeah, yeah.
interact.
Yeah.
That's right. That's right. That's right. Yeah. I would love to do that. I would love to do that. But yeah. So I'm gonna in the beginning of the video, I'm gonna take another video. I'm gonna put it up. I'm gonna let everyone know about your YouTube channel too. I always forget to do that in the beginning. But yeah. All right. So hold on. Let me stop recording. I appreciate everybody watching.